We're going to be doing imaging for the orbit, the optic foramen, which the optic foramen is the foramen in which the optic nerve runs through. So in order to do this, I like to start out again with the head in the as if we're doing a PA projection. Except what is going to be different regarding this is we're going to be looking at the acanthomeatal line. So I'm going to bring his chin out. Okay, check for the acanthomeatal line, which we have that all lined up. Get that good and perpendicular. And if you want to double check with your pencil, you can just visually look, making sure that is in line. Alright, now we have to turn the patient's head, and it's going to be the cheek, nose, and chin that's touching. Now he's kind of relaxed his head down just a little bit. And you always want to double check and make sure that once they turn their head, that the acanthomeatal line is still going to be lined up as if it's going perpendicular there. Okay. Now, we have to have this mid-sagittal line do a measurement of 53 degrees. Now that's really close to 45. If you want to start and aim for halfway, 45, and then adjust the head a little bit straighter up to get the 53, that will work just fine. But you do have to check it with the protractor to make sure you do have the 53-degree angle. Now, when I compare what I have here, I'm still not quite at the correct angle. So I'm going to turn this head up just a little bit more. Okay. Check the mid-sagittal, and then compare this with the protractor. Okay, now that looks a lot better lined up. So once you have the head in the correct position, then we're going to check and have the central ray go 1 inch superior and posterior to the top of the ear attachment, or the TEA. So we'll go 1 inch superior and 1 inch posterior to the TEA. Now we are imaging the orbit that is on the downside. So we'll go ahead and collimate tight. Okay, and then you can put a little right marker in that upper corner if you like, and that would, because a lot of you worry about even having your marker in the way. So you could do it in that fashion, is just put it on the very edge of the head. But when you turn the head like this, it's throwing this orbit that's up out laterally, so you don't see it. And you're shooting straight through and catching the orbit that is actually down against the image receptor or the tabletop. Okay, so that is the right side. We're going to do the left, so just get your patient back in our starting position by bringing the chin out, checking the acanthomeatal line. Okay, then from there we can just turn our head on out to the side, and we're going to have the chin, nose, and cheek touching. We're going to check our mid-sagittal line. Okay, and I'm going to have to adjust my protractor to 53. Okay, there's the mid-sagittal. I'm going to put the protractor right up against it to make sure that that angle is correct. Then we're going to go 1 inch superior to the TEA and then 1 inch posterior. Okay, we're going to use tight collimation again. Since this is the left side that is down, I'm just going to put the left marker to the outer edge of the light field there, and that will catch the marker. Okay, so that is our left orbit for the optic foramen. Now, not all of your patients are going to be able to get prone for this position. You have to do it with the patient supine. What you want to do is get your AML line going perpendicular. And keep in mind, I'm going to have you scoot down some more. Keep in mind, when the patient is in the AP projection, that the orbits will be magnified in this projection. When we did it with the patient in the prone position, the orbits are right up against the table, so you're not going to have as much magnification as you do with the patient in a supine position. But I'm going to start out as if I'm doing a mid-sagittal check. I'm going to have it centered mid-sagittal, and I'm going to center over the right eye. I'm going to collimate down. Now, in order to achieve our 53-degree head tilt, I'm going to tilt his head to the right. He's just rolling the head out until the light is shining over that left orbit. Usually, once you've accomplished this, that it usually equivalates to 53 degrees, but I'm going to check myself. There's my mid-sagittal. Move this around here. Okay, and I'm going to put my protractor right up against it, just to check my angle. Again, check, make sure you have your canthio-meatal line going perpendicular. Okay, and it's actually shooting right through the orbit, and we are imaging the orbit that the central ray is going through. So we're doing that left orbit. So this, again, if you want to place your marker here, or if you want to place it on the image receptor, just be sure that you move the marker in enough so that it will be seen, because we are collimating tight. Now, if I want to go for the right orbit, I'm going to start over, having the head mid-sagittal. You want to check it. And I'm going to scoot over and center over that left eye. I'm going to turn the head so that the light is over the right eye. I'll check my mid-sagittal line. I want it to be 53 degrees. Okay, so I have the 53-degree angle. I'll open it up just a little bit on the side, and again, double check. Make sure your ACL line is going perpendicular. Now, David brought his chin down a little bit, so I'm going to extend it up a little bit more to get the ACL line perpendicular. Okay, so there we are, centered over the right. You want to place your marker right here in the corner, or if you just want to move it in on the image receptor, that will be fine too. So this is just an AP method for the wreath.